Dozen people were killed, more than 60 injured in at least 10 mass shootings this weekend in the United States. Here to answer questions is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. Thanks for being with us, Dr. Raja.
Thanks, Eric.
All right, Dr. Raja, you and your staff know firsthand how much damage bullet can do to a human body. So when you hear there's been a shooting and victims are on the way to the ER, what goes through your mind?
Yeah, as you might imagine, Ben, this happens more than any of us would like. Fortunately, the initial response is really well orchestrated, right? All the trauma centers in Boston have these amazing teams of doctors and nurses and techs, all of whom have practiced the medical and the surgical response dozens, countless times. The hardest part is talking to the friends and the families afterwards, but all that comes later, after that initial response that we all know really, really well.
Yeah, I mean, we do, unfortunately. In the past month, Americans have been shot and killed at an elementary school, a supermarket, a graduation party last Wednesday inside an Oklahoma hospital. And the American Medical Association has now labeled this a public health crisis, in effect calling on the medical community to advocate for action. So what does that look like? What can doctors do?
Yeah, Erica, it really is a public health crisis. My friend Megan Ranney, who's an ER doc down at Brown, talks about this a lot. And she talks about the fact that we can use the same research-driven public health approach that's worked for things like decreasing car crash deaths to also work on decreasing firearms deaths. So that's what the AMA is advocating for. It's advocating for a number of legislative changes, but also for more research into what interventions work best to reduce firearm violence.
All right, Dr. Raja, we know you've got kids. As you well know, students practice, unfortunately, active shooter drills at school.
Oh, yeah.
Is the same true for the doctors and nurses at Mass General?
Oh, yeah, it is. So, Ben, we get annual training on how to respond to all sorts of potential situations of workplace violence. But here's the thing. If you look at national data, about half of ER docs report having been physically assaulted at work. That jumps up to 70% when you ask ER nurses. And it's not just active shooters. In addition to that shooting in Tulsa last week, there was also a stabbing in LA where a patient or a person presented to an ER, pretended to be a patient, and then stabbed 3 workers in an ER in LA. So fortunately, here at Mass General, we've got this amazing police and security department that focuses on de-escalation whenever possible, but also trains us on how to maintain situational awareness and then escape or defend ourselves if we have to.
Those are some unsettling statistics. All right, Dr. Ali Raja, we have to leave it there, though. Thanks so much for your time.
Thanks, Eric. I'm done.